So what are the 10 things that you must know about internal assessment in a DRNB or a DNB curriculum? So these are the 10 things. You must know what are the principles of this internal assessment, what are the parts of internal assessment, benefits, when to conduct this, how a theory exam is, you should not call as an exam, it's a theoretical evaluation, and performance counseling session, what is clinical assessment, how do we do it, what syllabus you are supposed to study, and does it have impact on final exam, what are the mandatory requirements for this final exam, the exit exam, and then how to submit this appraisal form and what it contains. Let's know these 10 things about the internal assessment. So, principally, why this internal assessment is there? This internal assessment is a formative assessment. Formative assessment is an assessment to form a good oncologist, a good doctor. So it's a part of teaching program. It is not an exam. Here, this assessment is not conducted to judge you. It is to identify those areas of weaknesses, make some modifications in teaching program, and very importantly, those NBEMS accredited centers has to develop into the centers of excellence, academic excellence. So these are the main principles and aims of an internal assessment in the DNB curriculum. It is not an exam, it is a formative assessment to identify the loopholes and correct them to make a better teaching program. So it not only benefits the trainees, but also benefits the faculty. So the faculty will be able to figure out what trainees know or they do not know. Because in a busy hospital practice, you may not have a formal interaction. So you can formally assess and you can know the strength and weaknesses of the trainees, number one. Number two, by knowing those weakness areas, you can make appropriate changes in the training programs. And very importantly, you can convert your center or you can upgrade your center into a center of academic excellence. So what are the benefits to trainees? They get motivated if you have such assessment programs. They can assess themselves, they can realize their strengths and weaknesses and set goals as to how best they can do in the exit exam. So when do we conduct internal assessment? It is conducted twice in a DNB curriculum. First one is in the first year. This is the super specialty dates which I have roughly put, but the first one is in the first year from August 1st to 30th. And the third one, the second exam is conducted in the third year. The second year exam is conducted by the DNB board itself, and it is called as a formative assessment test. So first year, internal assessment, second year, formative assessment, and third year is again internal assessment. The third year, it's around December 1st to December 30th. These are rough dates. You have to just go and check. So two internal assessment in a DNB curriculum, first in first year and second in third year. Okay. Each internal assessment has three components, three parts. One is the theory exam. Number two, based on your performance, the counseling session with the trainee or the candidate. And the third one is the clinical assessment. So how a theory exam is all about, it is always conducted on a single day. Okay. For the first year, there will be only one paper, and for the third year, there will be two papers. Remember, if there are two papers also, both the exams have to be conducted in a single day. And then it is 3 hours per paper. And in a paper, there will be 10 questions with 10 marks each to each question. And there will be a separate paper for the first and the third year. You can't have the same paper for both of them. Right. So how do you evaluate these answer sheets? It has to be evaluated by a senior faculty, a faculty who has a 5-year teaching experience to postgraduates. And you can, in fact, you may involve, it's not a compulsory thing, you may involve external faculty as well to have a real taste of an exit exam. And then, very important, these are not exams, these are formative assessments. Therefore, there are no marks in these exams. There are only qualitative assessments, and there are grades. And there are three grades. One is clear pass, that is P. Other is clear fail, that is F, and borderline, that is B. This is how we evaluate the answer sheets. There is no quantitative marking. However, I said there are 10 questions, 10 marks each, but still it's all about grades and there is no quantification in internal assessment. Okay. Now comes the post theory exam performance counseling session, which is very important in an internal assessment, which cannot be ignored. So the theory papers will be handed over back to the candidates. The senior consultants, PG teachers will have a counseling session with the candidates and find out their strength, weaknesses, and explain them how best they could write the theory paper in a better way. And you can, in fact, in a clinical assessment session, you can, in fact, combine it with the clinical assessment. Clinical assessment is usually done only for third year. Okay. Then comes the third component, that is clinical assessment. And this clinical assessment does not happen in a particular center, it happens in a workplace itself. Therefore, it's called a workplace-based clinical assessment. So first years are exempted from this workplace-based clinical assessment because they just entered into the subspecialty. So they would need some time for a clinical assessment. Formally, they're exempted. Only third years are the ones who has to go through this workplace-based clinical examination. And if there are so many trainees, maximum 8 trainees per day are allowed. And internal external examiners both are fine. External may be there, but it's not compulsory. So what is the scheme of a clinical examination? So it has 3 parts. So cases, viva, and discussion of thesis and log. 3 have equal weightage, and all the 3 are very important. You cannot ignore any one of them. So you have 2 cases, 30 minutes for preparation and 30 minutes to present the case for each. And viva is from all the examiners who are there. They will be asking you on investigations, instruments, techniques, interpretation, and so on. And very importantly, the discussion on the thesis and logbook. Logbook has to be maintained as to what you did for all 3 years. And how about your thesis? Have you submitted it? And how long you have gone into? So all these are important components of discussion in a clinical assessment. And then coming on to the clinical examination grades is similar to theory. You have 3 grades: clear pass, clear fail, or borderline. Okay, so what is the syllabus? So there is no specific syllabus. It's a standard training curriculum that you have. And does it have impact on final exam? Directly, no. Whatever grade you get, it has got no implication on your final exit exam. However, indirectly, yes, because the way you prepare, the way you take these internal assessments seriously, it will reflect on your exit exam performance. So directly, it does not have any impact. So what is mandatory? It is mandatory for a candidate to be present and has to go through the 2 internal assessment exams in the 3-year course. Usually it is done in the first year and in the third year. Okay. So while submitting the report, is the candidate name, specialty, registration number, and then what is the admission session of the trainee. And then these are this is how the submitting form looks like. Name of the trainee, registration number, whether he was present or absent, and what is the date of theory examination, what is his score in paper 1, paper 2, theory examination, what is the date of performance of counseling session. It's very important component of internal assessment. and clinical clinical examination, clinical assessment. You can see that there is no examination; it's clinical assessment uh, date, and then what is the result, what is the grade, and that's it. So all these internal assessments are conducted by the hospitals themselves, and NBS doesn't support. So uh, thank you for learning those 10 important points on internal assessment in DNB exams. Thank you.